I'm Rick McGuire. I'm the executive editor of CardioSource World News, and I'm with Chris O'Connor. And you are from Duke University, one of my favorite schools. My son just graduated from there. You're the director of the Heart Institute there.
That's correct.
And Dr. O'Connor is the very first editor-in-chief of a new publication from the American College of Cardiology. Can you tell us about it?
Well, Rick, we're very excited about the new journal, JACC Heart Failure. And
there's a sibling.
There's a sibling. It's now one of the three baby JACC journals, and really addresses, I think, an appropriate vision from the college and JACC that heart failure is one of the most important cardiovascular conditions in cardiology today, with an ever-increasing burden. And so having a journal that advances knowledge and communication in this field to improve the care of our patients is extremely important.
So when are you going to be coming up and taking papers, and what are you looking for, and when does it come out?
Well, Rick, we're going to start taking papers July 1, and we hope to have the first journal January 1, 2013. We're looking for the best papers, the highest quality papers in the area of human heart failure, clinical research, registries, clinical trials, those types of papers that meet really high standards.
I mean, the JACC family of journals has just done a phenomenal job of covering cardiology, and I'm so glad that they're taking a look at what is just one of the biggest problems that's only growing day in and day out.
Exactly right, Rick. I mean, I think if you look at the pressure on the health system from heart failure, the number one reason for admission to hospitals in patients over the age of 65, very high morbidity and mortality. It is imperative that we continue to do research, advance knowledge, and communication, getting the word out to the practicing doctors on how to better care for these patients. And that's going to be one of the important missions of this journal.
And what about the fact that there are so many comorbidities? When you've got heart failure, there's a real good chance you've got a variety of other things. Will that be a part of the journal too, the fact that you're going to be covering heart failure as a center, but it comes off it like a spokes that come off of it and going in every direction?
Yeah, I think as you look at this journal, we're really looking at a condition, at disease and condition, unlike technique or procedure like the other journals. And so we really will be focusing on in totality of what goes on to diagnose and treat heart failure patients. And a lot of that, there are comorbidities. The interaction with the kidney, the interaction with the lung, the interaction with the brain, these are all going to be important topics that we'll be pursuing in the journal.
Now, when it comes time to start submitting papers to the new publication, they'll be able to go online. It should have a website by then of its own, and there'll just be a button for paper submission. Correct?
Yes, it's getting very easy now to submit papers.
I know. I use it myself because I work with JACC on a number of things. It's like, oh, this is so easy to do.
Well, it's come a long ways from when I started out as a junior faculty member when it was all paper, but it's all electronic now, very easy. And there's going to be a nice relationship to the mother JACC journal and JACC Heart Failure, and that is if a paper is not quite prime time for Mother JACC, it will have streamlined access to be reviewed at JACC Heart Failure.
Great. I'm Rick McGuire, CardioSource World News. Check us out because we'll have a feature, and then you can come and read more about this conversation and some other material. Coming up soon, CardioSource World News.